Welcome to Ask Us Anything with Amber and Chelsea from Spark Mamas. Our first special guest is Dr. Alison Reminick.
So, Allison, one of the questions that I've had a couple of my clients ask me is how Zuranolone is different than some of like the SSRIs that a lot of my clients have heard about. For example, taking Zoloft to treat postpartum depression.
Yeah, that's a great question. So Zuranolone is not actually an antidepressant like Zoloft and Paxil and Prozac, the SSRIs. It's actually a neuroactive steroid. It's kind of related to our female hormone, progesterone, and it works at the GABA A receptor. So that's also where benzodiazepines and alcohol work to kind of relax your body and kind of like slow neurons down, kind of simplifying it. But in that way, it actually causes a little bit of like drowsiness and somnolence. They don't actually know how it works as an antidepressant. So it's quite different in that it's a completely different mechanism of action. So, and interestingly, that they've looked at treating major depressive disorder outside of the postpartum period with this drug, and it doesn't work, or they're not able to show that it's better than placebo. So I feel like it's really showing that postpartum depression is quite different than if someone were to have depression outside of the postpartum perinatal period. It's really working in a completely different mechanism. I think now, it could be a really good medication for things like premenstrual dysphoric disorder because of the mechanism, and also like perimenopausal mood disturbances. We kind of talk about how estradiol and progesterone go all the way up to the very top it's ever been in pregnancy, and then it takes a nosedive. And a lot of studies have shown that progesterone, which is kind of a parent of allopregnanolone, which is what the zuranolone is kind of the synthetic drug of. So a lot of studies have shown that patients who have postpartum depression are kind of low in allopregnanolone, or that allopregnanolone just doesn't work well at the receptor. So it's working in a completely different mechanism, kind of maybe like replacing the hormones that kind of took that drop.
With this drug, are there particular like clients where it wouldn't be maybe a good use? Obviously, with you had mentioned with major depression, but are there other instances where maybe this wouldn't be effective, or your ideal client that you might want to prescribe this to?
So, there's going to be a warning about not driving for 2 weeks while you're on the medication, while you're taking it. And I think that could be a barrier for some people taking it. I also think because it's going to be kind of considered a controlled substance like a benzodiazepine, I think us as a community might still be pretty vigilant about if somebody had or has a current history of substance use, or had a history of substance abuse, specifically with benzodiazepine misuse or abuse, because it seems to be kind of more within that category. I think that the ideal candidate might be somebody that's never been on a medicine, is kind of coming in to see a psychiatrist for the very first time, and doesn't want to be on a medication for a long time, maybe has pretty severe depressive symptoms, and you want to see them get better really quickly. And like I said, also the patients that maybe you're like kind of worried because their mom or dad had bipolar illness, or their grandfather, or they might have had kind of moments in their lifetime where they had a lot of energy and were talking really fast. Maybe those are the types of people that I would suggest this for instead of giving an antidepressant. I think breastfeeding is also going to be a consideration too. So we don't have as much data for breastfeeding yet, but they took 15 participants and they looked at their breast milk, and they saw that it's probably less than 1% of the maternal dose, which is kind of in line with like what we think is safe with breastfeeding. Still, all of the participants in the studies were told to pump and dump because we don't have as much. Obviously, we're not going to have as much data in the SSRIs like so for a long time with this medication.
Great. So those are two of the side effects that you've talked about. One is just still the uncertainty about how much of the medication goes through the breast milk, and the other one is the insomnia, or pardon me, not the insomnia, but the other one is the the fatigue and drowsiness and therefore not being
Yeah.
able to drive. Are there any other big side effects of the medication that were discussed in the studies?
Those were the big ones, like dizziness and confusion. So it sounded like it could be kind of related to benzodiazepines in that way, like fatigue and tiredness, which, I think we'd have to talk to our patients about in terms of when they take it the first time, what childcare and baby care is going to look like. Especially if I think they actually said they looked at participants and they gave them like driving tests to do during the study. And they saw that their reflexes were really like altered the entire time. So that's, they're going to be pretty strict, I think, about saying that they can't be driving when they're taking this medication.
So do we know yet what the cost of this medication will be, or if insurance will cover it, or we don't know that information yet?
I've talked with a lot of this Sage, that's the pharmaceutical company that's making this medication. I've talked to their medical liaisons, and they say that their goal is to make this really accessible to all postpartum new parents. And so I'm hoping that that's the case. I know that this is kind of where right now it's with insurance companies, and they're trying to negotiate about how much it's going to be costing and who's going to cover it.
When is the medication going to be available for you to prescribe?
That's a really good question too. I think they've said it's maybe going to be in the fourth quarter. So I was thinking maybe that's going to be like Thanksgiving, early December, probably before the new year, which is really exciting. I think it's I just love that there's just a different option for people, especially those. I think we have all had the patient where they're just really hesitant to take a medication for 8 months to a year. And that's kind of like the stumbling block that they don't want to kind of commit to something. And it feels like this is a much more doable 2 weeks, and maybe pump and dump during the time. Maybe don't drive and have your partner drive you.
When is also the time that you typically would have a patient start this medication? Like immediately after birth, 2 weeks, 4 weeks? Like, is there a particular time that they're finding like is the best time to start this?
Well, this study only recruited people that were severely depressed, I think, at the end of their pregnancy, the last 4 weeks of their pregnancy, and the first 4 weeks postpartum. So, and they all got started on it within the first 4 weeks postpartum. They didn't start anyone on it in pregnancy. There's not going to be any safety data for pregnancy for a long time. So I would say, so I've talked to Sage again about this. I think you could start them on it at any time within the first year postpartum. I also think that if somebody came on like an antidepressant, say that they're not doing well on Zoloft and they're already at max dosage, or they can't tolerate higher dosages, you can add this on. So they really kind of see this as being a potential to augment or help someone kind of quickly within 2 weeks. So I think there's not a lot of limitations in terms of who this can help. They don't have a lot of data yet for somebody who has the diagnosis of bipolar disorder and is having a depressive episode postpartum, but I can imagine this would also be a potential medication to treat bipolar depression postpartum along with their typical mood stabilizer.
Yeah, it's really exciting.
Yeah.
It is really exciting. And it seems like, there's a lot of opportunity to help our moms, especially during this really vulnerable window. As a psychiatrist, what are you most excited about this medication becoming available for the population that you treat?
I think because it's just giving our patient population attention. So I think what's really interesting is, and it's probably the same in a lot of mental health studies, but there was a pretty big placebo response in these studies too, which I think there's part of it. And I think you guys know as therapists, it's also just about calling attention to our patients and making them make sure that their mental health is a priority and they're asking for help and getting supportive people who can help them with their illness. Help them recover, because a lot of times I think the moms that we treat are in isolation, or having a hard time struggling getting help or recruiting help to get the treatment that they need. So I think that's the most exciting thing about this is the attention that it's putting on our patient population. And then it's saying how there's specifically, it looks like postpartum depression is a very different entity than major depressive disorder in the general population.
It can reduce some of the stigma associated with having a postpartum mood disorder, right? And it makes me also think a lot about our patients that they feel really hopeless, and having something that can work so quickly within the first 3 days can really provide a sense of hopefulness that gives, I think, us as clinicians an opportunity to do some really good work with them, because they're not feeling so hopeless about their postpartum experience or however they're feeling in terms of their mood.
I totally agree. I mean, I think when we have Zoloft, we have to typically tell them, like, you might feel really crappy for 2 weeks. And that's really hard to tell someone when they're coming to you at probably the worst moment in their lives, or one of the most, difficult moments, to tell them this isn't going to help you for another 2 weeks, potentially, or 3 weeks. That this is we can say this might help you day 2, day 3 is amazing. I think that'll be great for our patients who really need that quick response too.
Absolutely. And I think, as Amber mentioned too, the fact that this kind of destigmatizes it, because it is something that we see also works on just the hormonal fluctuation. And I think a lot of our clients are scared to go through multiple med trials till they find a medication that fits. So I know that I personally am really excited to get some of our patients in your hands once this medication becomes available.
That'd be great.
So if people wanted to have, I'm sure there's going to be a lot of anxiety about any new medication in general. Is there a particular resource or website that you would direct potential clients to that are interested in learning and reading more about this drug?
Yeah, I mean, I get a lot of my learning from the mentalhealth.org. That's the Mass General Hospital website. And so they already have a number of blogs about this medication, some really good, thought-provoking pieces, and they share the research. So it's probably where I get all my data from, and I think it's really patient-friendly too, their blogs.
We will make sure to link that resource as well as your New York Times piece in our comments section, so people can access that as well.
Okay. Thank you guys so much for having me. I really appreciate it.
Thank you for being a wealth of local knowledge and resources. We couldn't do our job without you.
Oh,
absolutely. We appreciate you.
It's a great team.
So thanks for joining us for our first episode of Ask Us Anything. We really appreciate you being here, Alison, and we would love to hear from our followers about topics of interest or questions they may have about anything from maternal mental health to reproductive health to parenting. I'd love to respond to those as therapists, but also access our Spark Mamas community, which is rich with providers who take care of mamas at all various stages. So feel free to email us or shoot us a DM, and we'd love to get in touch and follow up with any things that are particularly interesting to you.